Have you ever felt like you were breathing through a tiny straw? That desperate feeling when air just won't fill your lungs? It's a frightening sensation, a struggle for something so essential to life. Imagine running for a bus, your heart pounding, legs burning, and you're pushing your body to its limit. Or laughing with a friend, sharing a joyful moment, a burst of pure happiness that fills the air. And suddenly, you can't catch your breath. The laughter fades, the exertion becomes overwhelming, and your body screams for air. That tightening in your chest, a constricting pressure that makes each breath a struggle. That desperate gasp for air, a primal need, a fight for survival in what should be a simple act. Millions experience this every day, across all ages, backgrounds, and walks of life. This isn't just a fleeting moment, it's not a one-time occurrence to be easily dismissed. For many, it's a chronic condition called asthma, a persistent challenge that affects their daily lives. Asthma is a silent battle, fought internally with each breath each day. Often invisible but deeply impactful, shaping decisions, limiting activities, and casting a shadow on everyday experiences. Today, we're pulling back the curtain on this common, misunderstood health issue, shedding light on the realities of asthma. Asthma isn't a sign of weakness or something to ignore. It doesn't define you and it shouldn't hold you back. It's a serious medical condition that deserves attention and compassion, both from healthcare professionals and from ourselves. By understanding what happens inside the body, the mechanisms behind asthma, we can empower ourselves and others to manage it effectively. Knowledge is the first step toward better health, turning fear into action, and transforming uncertainty into informed choices. Whether you have asthma, know someone who does, or are just curious about this widespread condition, this is for you. Let's break down the science, share practical advice, and offer hope for a healthier, more fulfilling life. Living with asthma means learning to manage your health with confidence, taking control, and embracing a proactive approach. So let's discover how to navigate this journey, breathe easier, and live fully. So, what's really happening inside the body when someone has asthma? It's more than just a cough or a bit of trouble breathing. We need to delve deeper to understand the true nature of this condition and how it affects the respiratory system. At its core, asthma is a chronic inflammatory disease affecting the airways. This means that the passages responsible for carrying air to and from your lungs are constantly in a state of inflammation. These airways, also known as bronchial tubes, are the vital pathways that ensure the flow of air in and out of your lungs with each breath you take. In healthy lungs, these passages are open, clear, and allow air to flow freely, ensuring effortless breathing. The airways are relaxed and unobstructed. However, in individuals with asthma, the airways are hypersensitive, reacting strongly to various stimuli. They're also always a bit inflamed, even when you feel fine and aren't experiencing any noticeable symptoms. This underlying inflammation is a key characteristic of asthma. This chronic inflammation makes the airways twitchy and overly reactive to triggers in the environment. These triggers can include things like pollen, a common allergen, dust, especially household dust that contains dust mites, cold air, which can irritate the airways, or even strong emotions like stress or anxiety, which can sometimes exacerbate asthma symptoms. When a trigger strikes, the airways overreact, leading to a cascade of events within the respiratory system. This overreaction causes the airways to narrow, constricting the flow of air and making it difficult to breathe comfortably. The body's reaction to this trigger and airway constriction: the lining of the airways swells and becomes inflamed, further narrowing the space available for air to pass through. In addition to the swelling, extra mucus is produced within the airways, clogging things up even more and creating further obstruction to airflow. This combination of inflammation, swelling, and mucus production leads to the classic and recognizable symptoms of asthma, including wheezing, a whistling sound during breathing, coughing, which can be persistent and sometimes severe, and shortness of breath, making it feel like you can't get enough air. It's important to remember that asthma isn't just an allergy, it's a more complex condition. It's a complex mix of both genetics, meaning inherited predispositions, and environmental factors, such as exposure to allergens or pollutants. But the good news is that asthma is manageable with proper care and treatment. Understanding the underlying mechanisms of asthma, particularly the inflamed and sensitive airways, helps explain why treatments primarily focus on calming down the inflammation and reducing the sensitivity of these airways. With the right approach, including medication and lifestyle adjustments, you can effectively manage your asthma and keep it under control, allowing you to live a full and active life. Let's zoom in on what happens during an asthma attack. First, the muscles around the airways tighten, a process called bronchospasm, making the airways narrow. Next, inflammation ramps up, causing the airway lining to swell even more. Imagine a tunnel shrinking from both the outside and inside at once. Then, thick mucus clogs the already narrowed airways, making it even harder to breathe. The result? Wheezing, coughing, chest tightness, and a desperate struggle for air. Every breath becomes a battle. This three-part storm, muscle tightening, swelling, and mucus, makes asthma attacks so frightening. Modern treatments target each part, relaxing muscles, reducing inflammation, and clearing mucus. Understanding this process is key to effective management. Asthma attacks are complex, but with the right tools, they can be controlled. Living with asthma is more than just dealing with attacks, it's a daily challenge. People with asthma are always on alert, scanning for triggers in their environment. The constant mental load can be exhausting, and the physical effects, like a persistent cough or disrupted sleep, can drain your energy. For kids, it can mean missing out on sports or play. For adults, it can affect work and family life. Anxiety about the next attack can lead to avoiding activities and feeling isolated. Support from family, friends, and teachers is crucial to help people with asthma live fully. Poorly controlled asthma can cause long-term lung damage, so proactive management is vital. Taking control now protects your lungs for the future. Prevention is your most powerful tool. Start by identifying your personal triggers. Keep a journal to spot patterns. Common triggers include pollen dust, mites, pet dander smoke, and strong odors. Once you know your triggers, take steps to avoid them, like using allergen-proof bedding or staying indoors on high pollen days. Maintain a healthy weight and eat a balanced diet to reduce inflammation. Don't avoid exercise. Regular, moderate activity can strengthen your lungs. Just warm up, choose the right activities, and keep your inhaler handy. Avoid tobacco smoke at all costs. Small lifestyle changes can make a big difference. Talk to your doctor about staying active and safe. Managing asthma means using both long-term control and quick relief medications. Daily controller medicines like inhaled steroids reduce airway inflammation and prevent attacks. Quick relief inhalers relax airway muscles during symptoms. Always keep one with you. If you need your rescue inhaler often, your asthma isn't well controlled, talk to your doctor. Create an asthma action plan with your doctor so you know what to do every day and in emergencies. Breathing exercises, staying hydrated, and managing stress all help. Medication and lifestyle go hand in hand for best results. With the right plan, you can breathe easier. We've explored the multifaceted challenges that asthma presents, and we've also highlighted a range of effective solutions. We've looked at management techniques, treatment options, and lifestyle adjustments that can make a real difference. But beyond all the information and strategies, the most important message we want to leave you with is one of hope and empowerment. Asthma may be a part of your life, an aspect that requires attention and care, but it absolutely does not have to define who you are, limit your potential, or dictate the course of your life. With the right knowledge, a proactive approach, and the appropriate tools and medications at your disposal, you can live fully and thrive. You can run with the wind in your hair, play with boundless energy, travel to far-off lands, and pursue your dreams with unwavering determination. Remember, your experiences, both big and small, matter deeply. Sharing your personal story, your challenges, and your triumphs can be incredibly powerful, helping others feel seen, understood, and less alone in their own journeys. Engage in open and honest conversations with your friends, your family, and within your community as a whole. Together, we can erase the stigma surrounding asthma and build a strong, supportive network for everyone affected. Stay curious about your health and well-being. Ask questions of your healthcare providers and regularly update your asthma action plan to reflect your current needs. Always seek out trusted and reliable resources for information and guidance. Remember that health is a journey, not a destination. Embrace it with an open mind, a willingness to learn, and a commitment to self-care. Promise yourself to listen attentively to your body's signals, seek knowledge to empower yourself, and extend your support to others who may be struggling. Don't let fear or anxiety hold you back from living your life to the absolute fullest. Breathe in the boundless possibilities that life offers, and breathe out any fear or doubt that may be holding you captive. Your breath is a precious gift, and so is your life. So go forward with confidence, breathe easy, and live your life to the fullest potential. What will your next step be on this incredible journey?